Thank you, Dr. Cho and Dr. Wu, for your kind invitation. It's really an honor to be presenting my experience following patients for upper endoscopic examination and gastric cancer screening in Koreatown. And just as an anecdote, just recently, as a follow-up to Dr. Wang, as a comment about the difficulty of doing screening endoscopy in the U.S., I underwent that on audit by a Medicare because they were concerned that I was doing too many upper endoscopies. And they said, why are you doing so many endoscopies? And so we want to look at all your chart. And this is a real issue for all of us who are performing screening endoscopies for Korean Americans. And I'm very thankful that Dr. Wang and everybody else in this room have been instrumental in trying to develop a movement against that bias. To start, this is a pretty well-informed crowd, but gastric cancer is a very common cancer with over 1 million new annual cases worldwide. It is actually thought to be the second leading cause of cancer-related mortality worldwide, and 50% of all cases occur in the Far East. I think the reason why we're here is because gastric cancer, of all the countries that are studied, is the most common. The incidence to be most common among Korean Americans, Koreans with the highest incidence for both women and men, and compared to other countries, it's pretty astounding how prevalent this illness is among Koreans. Dr. Hwang mentioned the disparity between Koreans and other races, but I'd like to go back historically and look at the incidence of gastric cancer in the US, because I think very few people are aware that among all the cancers that are studied, lung cancer, for example, had a very high increase in incidence over time due to smoking. There has been substantial decrease in incidence of liver cancer, for example, over time. But what's striking in this graph is the persistent and consistent decline in the incidence of stomach cancer in the US. And in fact, if you look at what happened in 1930s, stomach cancer was the leading cause of cancer-related mortality in the US for both men and women, far more common than any other cancer facing individuals in the US. Over time, however, from around 45 per 100,000 individuals dying of stomach cancer in the country to around 4 per 100,000 as of 2011. So it's almost 90% reduction in their incidence of stomach cancer. And no wonder, all these government agencies and society are no longer interested in gastric cancer. It is not as common in the US as it has been. What's interesting is that this decline in the trend in gastric cancer is not confined to the US. In fact, if you look at this graph from 7 European countries over the past 6 years, every single country studied has shown decline in the incidence of stomach cancer. Whether it's UK or whether it's Finland, they all have shown gradual decline in the incidence of stomach cancer. And in fact, if you look at all the countries in the world, there has been consistent decline in the incidence of stomach cancer with one provider. There are two distinct groups. There's this high group that has, sorry. that there is a group that has high incidence, such as Japan, Korea, Chile, Russia, and then there are lower uh, group that has lower incidence, but still they both show gradual decline in the incidence of stomach cancer over time. And there's no exception, it appears, in terms of what's happening with the stomach cancer over time. And this is a graph over the 6 years, so it took a long time, but persistent decline is pretty striking. What happens then to people from high incidence country compared to those ethnic background who move to US, a country that is thought to currently pose lower risk for stomach cancer? There's two groups, as you can see. If you look at incidence of Japanese living in Japan, it's much higher than those living in the US. Japanese living in the US, San Francisco, Los Angeles. If you compare to those people, people in Japan have much higher incidence. And in fact, these two groups also have much higher incidence compared to white or black Americans. But regardless, there is a persistent decline in the incidence of stomach cancer for both groups. So the question really is, with Korean Americans, what's happening? You know, Korean Americans are known to have high risk for stomach cancer, but they are residing in the country that has lower, significant, one of the lowest incidence of stomach cancer worldwide. And, you know, what can we learn from looking at the patients who undergo upper endoscopy in Los Angeles, for example? I have been in private practice for the past 25 years, and the primary patient population that I cater to are Korean Americans. And based on these decline in overall incidence of stomach cancer, we were interested in looking at the issue of whether gastric cancer is still relevant concern for Korean Americans. And if so, how significant is this issue? And you know, if that's the case, should we still be considering gastric screening for these Korean Americans? So Dr. Wu emailed me about 2 weeks ago. Said, can you talk about you know, your experience in Koreatown? So I basically picked 100 patients, consecutive patients from 1 year ago. Exactly 1 year ago, and looked at our experience to remove as much bias as possible to see what kind of patient population we're seeing, what are their risks, what are the findings on patients who are undergoing upper endoscopy at our center. What was pretty surprising to me was that their median age was fairly high, quite high at 75. They're far more female than male. History of smoking was very low, actually, only about 11%. And 99 out of 100 spoke Korean, which meant that they were born in Korea. One patient was born here, but she was essentially a second generation Korean American. So we're dealing with these patients who were born in Korea, who immigrated to US, and currently live in Los Angeles. And what's also very striking to me was that out of 100 individuals that we examined, 93 already had endoscopy, which meant that endoscopic screening or endoscopic studies are very common for Korean Americans. It's not like, you know, you have it once in a while. 93 patients who came to me essentially for second or more bout of EGDs. When we looked at their prior histories, 2 had prior history of gastric cancer, 6 had history of dysplasia, and 28 had gastric intestinal metaplasia. The condition that Dr. Huang just mentioned is a very important precursor to gastric neoplasm. The indication for these individuals were various. Dyspepsia was very common. Weight loss, anemia, ulcer, and weight loss were among the indications. But what was, I think, very striking was there were only 2 who came primarily for screening. So 98 had some other reason for undergoing endoscopic examination. The screening per se was not an important reason for them presenting for endoscopic study. There were other premalignant indications, such as history of metaplasia, family history of gastric cancer. 5 had a history of dysplasia previously, and 2 had a prior history of gastric cancer. These individuals were quite symptomatic. In fact, 75 patients had been on some type of GI medication in the preceding 12 months prior to presenting for endoscopic examinations. And benign findings for the usual erosions, H. pylori, peptic ulcer disease, and GERD and so forth. But I thought it was very interesting that we checked for H. pylori on every patient who undergo endoscopy, and only two had H. pylori. So, either we're doing a great job of eradicating H. pylori, or it's not very common here. You take your pick. So what do you think we found in terms of number of neoplastic findings? This was a random 100 consecutive individuals we did endoscopy. And what would you expect to be an yield of GI studies on such a group of population? Any guess, Dr. Wong? I don't routinely do test for metaplasia on patients who already have a history of metaplasia. So because it would be duplicating, the diagnosis and also add to the cost. But what we thought was very interesting was that out of 100 patients, 6 had new diagnosis of metaplasia on top of 28 previous findings, and 2 had de novo diagnosis of dysplasia, and 4 actually had a diagnosis of gastric cancer. So in fact, and 1 had a B-cell lymphoma, but that's sort of unusual. So, the yield was quite high. Actually, I had not expected to see this many cases of gastric cancer doing 100 of endoscopy. And I think this risk is real. And if you can get this type of yield on any type of diagnostic test, I think you're doing quite well. And you're doing great service. So in conclusion, I think, in terms of our experience, we feel that gastric cancer is still a very important issue for Korean Americans in Los Angeles. And for that reason, we think periodic screening should continue. Thank you very much.